on constant oxygen to help with his breathing.
Hello, Mark. I'm all right, thank you.
46-year-old Mark Rye has been in hospital since before Christmas after catching COVID. He has underlying health conditions, but is triple vaccinated.
I just thought it would be like a bad cold. But when you're actually sitting there and you literally feels like you've got a lump of lead across your chest.
As COVID cases in the community are at their highest ever, hospitals like Frimley Park in Surrey fight to protect vital services. A week ago, they took the decision to stop visitors, trying to prevent a repeat of last year where the army came here to help. But elsewhere, it's become unavoidable. Today, 200 army personnel have been deployed to help some hospitals in London grapple with the situation. The NHS is facing a combined pressure of the highest number of COVID cases in hospitals since February last year and the most amount of COVID-related staff shortages since January. Figures released today show that in the time between Christmas and New Year, staff shortages rose by 60% in England. In the last 24 hours, both Northamptonshire and Staffordshire have declared a major incident, indicating the pressure not just on the emergency services, but social care too.
We are still seeing rising hospitalisations, particularly with the case rate rising in older age groups. That is of concern. And I think we have to be honest, and when we look at the NHS, it will be a rocky few weeks ahead.
A few hospitals have declared critical incidents. Do you think you've escaped that here, or are you worried that might be coming down the line?
Well, we're busier probably than we have been since last January, but it's manageable. There's always a concern, but at the moment we are hopeful that things will allow us to keep operating as we are.
Doctors here credit the vaccine rollout for so far preventing a repeat of the high fatality rate last year. Still, they see many through their doors who haven't yet been jabbed.
The vast majority of them are regretful, and actually once they get to that point, they will often say, you know, I wish I'd got round to having the vaccine.
All of these latest pressures, of course, are after almost 2 years of relentless care for those working with COVID patients.
It's been really challenging. I found it quite emotionally difficult at times. The patients have, you know, have really struggled with, you know, their breathing and seeing that and them being detached from their sort of families and things has been, you know, quite difficult.
When all of this is over, Dr. Orchard says there will need to be time for NHS staff to process what they've witnessed during the pandemic. But for now, there's still patients to care for.
What would your message be to those who aren't taking the pandemic seriously anymore or don't want to get their vaccination?
I think they really need to think twicely. You know, it's not a case, it's not a game. It's really not a game. You know, you've got one choice here. You're either one of the lucky ones or you're not.
Well, earlier I spoke to Matthew Taylor, Chief Executive of the NHS Confederation, and I asked him if NHS staff are unable to come into work at the moment because tests aren't available.
I think the test situation is getting a bit better than it was a few days ago, but it is not the case everywhere in the country that people can get access to the tests that they need to get. And of course, the testing regime itself is under continuous examination.
Right, so what do you and your NHS colleagues make of what Boris Johnson has been saying about the NHS and just getting through this and his assurances to the NHS?
The NHS did not come into this crisis in the most resilient of states because of years of underfunding. We had 100,000 vacancies. So we weren't as resilient as we needed to be. We've had 2 years of this. And it means that in the face of this challenge that we're not able to do all the things we want to do. So sadly, I suspect that those waiting lists that have been growing, that longer than we've ever seen before, will grow longer because some hospitals are having to cancel non-urgent operations. So we will get through it. The question is what kind of position we're going to be in when we get through it.
Well, you ran policy for Tony Blair in Downing Street. If you were in Downing Street now, what would you be telling the Prime Minister he needs to do to put the NHS back on some sort of workable footing?
I think the one thing I would want more from government is a very clear message about the kind of pressures that the NHS is under, so that people understand that we do need to take personal responsibility. We do need to understand that the NHS may not be able to provide the full range of services or the quality of service that it would normally want to provide. So it's not about being alarmist or panicking. It's about being really straight with the public and saying to them that over these next few weeks, and we all hope it'll only be a few weeks, things are going to be very difficult.
And how are you supposed to be honest with people about the suffering that they are going to have to put up with in terms of cancellation of elective surgery and much-needed treatment that for them is not optional, it is essential?
So I think what people need to hear is that the NHS is making decisions in the short term, backed by NHS England, backed by the government, which are about prioritising those most in need in this very difficult situation we're in. Then they need to know that after that, the resources will be made available to rebuild, to address that terrible backlog that we've built up over the last 2 years, and also to learn the lessons. You know, Christian, 18 months ago, we were all talking about building back better. We're all so exhausted now, we don't really talk about building back better, but actually we need to remind ourselves of those principles. We came into this crisis having had many, many years of underfunding, 100,000 vacancies in the NHS, a capital stock that was in bad repair. It meant we were not as resilient as we needed to be. And you know, in the next few days, we're going to pass that terrible milestone of 150,000 deaths. And I think that our memorial to those 150,000 people needs to be to make sure that we build a health service that is going to be resilient for future challenges like this.
Matthew Taylor, thank you very much.
Thank you.